Thanks for joining us today. Today kicks off our virtual Caregiver Cafe, a 4-part series called A Caregiver's Guide Dealing with Dementia. Today's discussion is understanding dementia, the types, causes, and symptoms. We are excited and blessed to have Lori Bishop with us today. During the presentation, if you have any comments or questions for Lori, please utilize our chat box and we'll be monitoring that throughout the presentation. So just to give you a little bit of background about Lori Bishop, Lori is a graduate of Auburn University, and by trade, she's a certified financial planner. Lori and her husband, Mike, have a firm in Alcoa, Tennessee, where they help guide families through the maze of decisions that they face as caregivers. In 2020, they formed the Caregiver Superhero Society, a nonprofit that focuses on educating and supporting dementia caregivers. Like many of you, Lori is a dementia caregiver. Her passion for helping caregivers comes from being a caregiver for her parents since 2015, both which were diagnosed with dementia. Her deep involvement in the caregiver community led her to her appointment as a certified trainer with the Rosalind Carter Institute for Caregiving since 2018. It is in that capacity that she comes to us today. Lori, welcome.
Thank you. Thank you very much. I'm going to share my screen and we will get going. All right. Am I good, Tracy?
You are good.
Okay. So, hi, everyone. I want to thank AARP for the invitation to speak with you today. And I thought I would start by sharing a little bit of my story with you. Let's see. This is me and my dad. In 2015, Dad dropped into a deep depression over the course of literally 2 weeks. He became very paranoid and went from being life of the party to being very withdrawn, not speaking above a whisper, not eating. His regular doctor had no idea what to do. So we went through a series of things, and my mom and I spent about a year struggling with how to handle that situation until we finally realized that a lot of his symptoms may be the result of dementia. And so that led me to researching more, attending support groups, and eventually becoming a trainer with Rosalind Carter Institute. So that has become my passion. And so that's why I'm here today. And hopefully can bring you some information from the Dealing with Dementia program that Rosalind Carter offers. So we will jump right into it. Today, I want to talk a little bit about what is dementia, different types, symptoms, and causes. The dementia is a brain disease that affects memory, language skills, visual perception, the ability to focus and pay attention, the ability to reason and solve problems. And there are also some physical issues that are related to brain disease. So we'll talk a little bit more about that. Let's keep going. This is a great diagram from the Alzheimer's Association, and it's a good way to explain dementia. So dementia is really an umbrella term, and it covers a group of symptoms, various diseases that affect memory, thinking, social activities, anything that is enough to interfere with daily life. So the type of dementia that someone has is related to the area of the brain that's affected or how it's affected. So Alzheimer's, you can see 60 to 80% of cases of dementia are related to Alzheimer's. So that's the most common type of dementia, but there are others that you can see here. The top ones are Lewy body dementia, vascular dementia, frontal temporal, Parkinson's, and there are several others. We're going to talk about these top ones today. But you can also have someone who has mixed dementia. For example, my father has been diagnosed initially with frontotemporal dementia and now also has Parkinson. So he has a blend of 2 different types. So what causes dementia? So dementia is caused by damage to brain cells. So it could be from a head injury. It could be a blockage of blood flow. It could be that proteins have built up and caused plaque or lesions in the brain, and that interrupts brain function. So whatever brain cells are damaged, the brain can't use that area to do the work it usually does. So, different parts of the brain work different parts of the body. How and where that cell damage occurs will determine that type of dementia. There's another slide here. This one, I think I'll stay on this one for a minute. The various types of dementia could be mental or physically, challenging. So if we go back to my dad as an example, frontal temporal dementia kind of bridges between mental and physical. Parkinson's is more physical. If you look over at Alzheimer's, that's primarily a mental, memory capacity. So on this spectrum, you can see folks who may be able to live more independently, folks who will eventually be dependent on someone else to care for them, and whether it's mental or physical. So, so you can kind of tell from this what you may be dealing with. So let's go into a little bit more detail. So cognitive dementia symptoms may be memory loss. That's what everyone tends to associate with dementia. The confusion or disorientation. If we go down difficulty in the following areas, communicating or finding words. So my dad's very non-communicative. That's one symptom of his type. My mom has Alzheimer's. And this is common, she can't find the words that she wants to speak. So her physician actually talked with me after the Christmas holidays one year and said, your mom's doing a lot worse. And I said, how do you know? And he said, I ran into her in the grocery store and she could barely carry on a conversation with me, which I was very surprised. And he said, here's the difference between having a conversation with me and you or somebody else. He said, I know not to fill in the blanks. He said, if she's pointing to a bottle of ketchup and can't think of the word ketchup, you say, and she says, pass me the, I'm going to fill in the blank and say ketchup because I see she's looking at ketchup. So if you'll look at it that way, if you stop filling in blanks for words, how well can they communicate? They may refer to their watches, that thing that tells time. So that's one example. Visual and spatial abilities, getting lost while driving. Driving is a major issue, in this world, and we can talk some more about that later if you'd like. But turning right without looking left, sometimes is that not being able to juggle and many things at one time. So reasoning and problem solving, handling complex tasks such as balancing a checkbook, scheduling and keeping up with doctor's appointments, managing medication, which is part planning and organizing. So those are really the top three that you want to start, worrying about is, can they manage medication? Because if they don't do well at that, the results cannot come out good. Can they manage finances, and can they drive safely? Safety is a major way to judge whether somebody needs help at that point in time. Are they safe, and is the caregiver safe? So there are also psychological symptoms of dementia, personality changes. For my dad, going from joking around all the time to not speaking was a definite personality change. But some people can also can be, I met a missionary couple once, and he had frontal temporal dementia. And that change of behavior resulted in him being somewhat violent, saying things to his wife he would never have said otherwise. So that whole change in personality. Depression, which is how my dad's manifested, anxiety, inappropriate behavior, loss of a filter, saying things that you would not normally say, or hearing things from your spouse or your parent that, are hurtful sometimes. That ability to make those decisions and decide what's appropriate can leave them. And so you have to not be angry at them, but be angry at the disease. Paranoia is another one, thinking people are stealing. We've had in the caregiver groups I work with, caregivers who were worried that they were going to be killed by their spouse because their spouse thought they were an intruder. So things can get really manifest in very dramatic ways or very slight ways. Agitation, hallucinations. Hallucinations are one of the Parkinson symptoms. So I've had some experience with that personally, and it's hard to watch somebody go through that. But those are psychological symptoms. A lot of those can be helped with medication. There's no cure for these, but there are medications that help that. So what happens in the brain that causes this? I want to keep this in as much lay terms as I can, but deterioration of the brain can start 10 years before you ever notice a symptom. So somebody could be symptom-free, but in the brain, there's some toxic changes that are occurring. They're referred to a lot of times as plaques and tangles. So in this diagram here, those little tentacles that reach out to connect, that's what sends signals throughout the body. So neurons is what that's called, send messages between different parts of the body for brains and muscles and organs. So in the event of Parkinson's, where somebody starts that shuffle, that the neurons that help them understand how to walk, or for their feet to know where to go, is not connecting well, and eventually they're unable to do that. The same way, let me show you one other diagram. Imagine a lamp that has a frayed cord like this. So sometimes, depending on how that cord is laying, sometimes that lamp will turn on and sometimes it won't. So why does that happen? Because that connection that carries that signal from one place to another may not be making it. That part of the brain has deteriorated. So in fact, some people think about loved ones who, may be 80 years old, but they talk as if they're in their 30s. They talk about things that happened in their 30s, and that their spouse is, out fishing and they may have been dead for 20 years. What happens, or what people think happens, are those connections are connecting to a past memory. So the wires are crossed, basically, if you want to put it in very simple terms. But that's one of the things that happens. So you can't remind somebody enough. You can't fix that. You have to a lot of times go along with it. So I'll jump in here. Some of the tips that we give in the full workshop. If you're taking care of somebody and they keep talking about a spouse or child or someone who has already passed away, the best thing to do is go along with that. If they say, "Where's Jack? I think he's out fishing. He'll be back soon." Or, don't say, "Mom, Dad's been dead 20 years. You know that." And she doesn't know that. And when you say that, she's going to mourn for her spouse as if she just found out. So think about that. They can't help it. And I encourage people to go along with it. My dad had a hallucination that he went out of the facility he's in at 3 a.m. in the morning. And the attendant brought him back in and talked to him. And later the next day, I asked him, "Dad, where were you going?" He said, "Well, I had to go out and check the work they were doing on the back of the house." And I said, "Well, did they do a good job?" And he goes, "Yeah, they did okay." So in his mind, that was what happened, and there was no question about it. So just go along with them for that journey, and kind of be where they are, and not try to force them into where they should be and what they should be thinking. So let's talk about different types of dementia. So Alzheimer's, early symptoms are going to be remembering recent conversations or names or events. Apathy and depression. When my dad first went into that, my mom kept saying, "Well, it's just because he can't physically do what he used to do." That's not necessarily true. He could have, but was just unable to because of depression and you know, a change in personality. Um, Later symptoms of Alzheimer's would be impaired communication, poor judgment, confusion, behavioral changes. A lot of seniors are taken advantage of by scams and things like that, but some of them are very openly, um, situations that they should not provide information, personal information, and yet they do. Um, they might be confused about how to play a game they've always played. Um, Lots of different examples. I'm sure some of you have your own that you can bring up as well. Difficulty speaking, swallowing, and walking. And in fact, most deaths from Alzheimer's end up the ability where the brain just does not remember how to swallow. And so someone might aspirate and develop pneumonia, different things like that. Treatments, there's no cure for Alzheimer's at this time, but there are some drugs and non-drug treatments that can help. They may only work for a certain period of time, but they can assist. For example, there's one that will help those neurons, the little tentacles in the frayed wire, connect a little bit better and maybe improve that slightly, but you still see a deterioration. So as the brain deteriorates, let me go back here, the ability to carry out a simple task becomes more difficult. If you think about it like aging backwards. So my mom went through a period where she was almost like a teenager. Her driver's license got taken away and she threw big fits and was not an easy person to be around at that point in time. Now she's more like a child in elementary school who wants my approval of things. She doesn't want to make a decision without asking me. And she's a little more compliant like that. She has difficulty learning complex things. So you have to think they're aging backwards, but you could teach a 3-year-old or a 5-year-old how to do something. Whereas in this case, you're going the opposite direction. New learning is going to be very difficult. So keeping things very simple is going to be key to caring for that person and for making your life a little bit more bearable in those situations. This is an Alzheimer brain. Just, if you look on this left side of the screen, that's a healthy brain. Someone with Alzheimer's, the brain starts to shrink. You'll notice, these are getting a little bit more wiry and look kind of dried up at the ends. These are the plaques that I was talking about, so lesions in the brain. So there's a definite difference in the brain of someone who's normal and someone with Alzheimer's, and there is a PET scan is what they call it, that they can actually determine what areas of the brain are primarily affected. Vascular dementia is another type, probably second in line to Alzheimer's. And early symptoms of that are impaired judgment and the ability to make decisions, plan, and organize things. So if you think of someone who's had heart issues in the past, vascular dementia a lot of times is related to that. Blood vessel blockage, damage from strokes, bleeding in the brain. So the number and location and size of those brain injuries from those events determine how that individual's physical functioning and thinking are affected. If you think about somebody who has a stroke, we see very physical evidence of what's been impacted in their brain. But someone with dementia, we can't see their brain. We don't know what area of the brain is causing the problem. So you have to depend on family members and people who are around to start determining that. There are no treatments for symptoms of vascular dementia, but there are some Alzheimer's medications that will help in a modest way. Risk factors for vascular dementia sound like a lot of America. We have diabetes, obesity, heart disease, lack of exercise and unhealthy diet, smoking and long-term alcohol abuse, someone who's had multiple strokes. If you have somebody who has those health issues and you're seeing some issues, it could be Alzheimer's, it could be a vascular dementia. Also dementia with Lewy bodies. So symptoms of that are memory loss, similar to Alzheimer's, but in this case, they're more likely to have other things like sleep disturbances, hallucinations, maybe their gait is a little bit off, or their walking is not stable. So similar to Parkinson's. The brain changes. Lewy bodies are those clumps of protein, those little tangles that I showed you earlier. When they develop in the brain, a deep area of the brain, dementia can result. So if somebody has vascular dementia or Alzheimer's, they may also have Lewy bodies and have that mixed type of dementia. So back to that green chart where it showed what's physical and what's more mental and dependent or independent, those mixtures you kind of have to judge from that. There's no treatment right now to slow or stop that brain damage, but there are strategies on focus that help symptoms. Parkinson's disease. With Parkinson's, you'll notice more problems with movements. People whose hands tremor, or who their gait, their walking becomes more of a shuffle. Those are early Parkinson's symptoms. I have actually a client of mine who just retired early because he is an ophthalmologist and cannot, because of the tremors in his hand, cannot manage the equipment that he needs for that. And it also makes his patients very nervous. In Parkinson's, those clumps or bundles that are in the brain are in the deep area of the brain. And that is an area where dopamine is generated. So dopamine is like that neurotransmitter. It's what sends messages to cells. So if you're low on dopamine and that's not produced, then your brain's messaging signals or system does not work well. There's no treatment for Parkinson's, but there are some medications that will help. My dad takes one for hallucinations, and that has stopped hallucinations. So mainly the focus is on helping symptoms. With Parkinson's, there are not any tests that can be done that will indicate whether you're going to have Parkinson's or not. There are also theories that Parkinson's can be have a factor caused by toxins or the things that we eat and the things that we're exposed to in the environment. Men are more likely to get Parkinson's than women. And people who have a parent who suffered with Parkinson's are twice as likely to develop Parkinson's disease. Not a guarantee, so don't panic. But that is some of the things that we see in research. Frontal temporal dementia, this is the type my dad has. So symptoms are change in personality and behavior, difficulty with language. Basically, frontal temporal means the front part of your brain, so that forehead area. And that's where executive functioning takes place. The ability to follow instructions, to follow conversations, to make decisions. So, for example, my dad is very anxious in a room with more than 2 or 3 people. The reason for that is someone with frontal temporal dementia has a hard time following conversations. If one person speaks on one side of the room and somebody's answering, they become very anxious because they can't follow that conversation. They don't know what might be an appropriate comment to make in that conversation. So that causes a lot of anxiety. Also, following instructions. So you might say, and this kind of goes across all types of dementia. At some point, it could be early on as in frontal, or it could be later on as in Alzheimer's. That ability to follow more than 2 or 3 instructions in a row is impaired. So you might say, go into the living room and put on your robe, go in the living room and sit in your chair. Well, they may put on their robe and still stand there. And then you have to say, go in the living room and sit in your chair. They may just make it and stand in the living room. So one instruction at a time, and that takes a lot of getting used to, but it will save you a lot of stress if you learn early on to speak in very simple terms and give simple instructions. Brain changes. So just like I had mentioned, it's in the front and side region of the brain. A lot of people will notice this at a younger age, and a lot of people with frontal temporal survive fewer years than those with Alzheimer's. So it is not, I've seen people run the gamut of time periods that they struggle and deal with this. But in general, if you look at research, Alzheimer's will last longer than frontal temporal. There's no specific treatment. There are medications that will help with that agitation and irritability and anxiety and improve their quality of life, but there's nothing that will stop that situation. It is a progressive disease like all dementia. Risk factors, 40 to 50% show a mutation that could be inherited from a parent. So, with all this, I've had people say, well, Lori, your dad has Parkinson's and frontal temporal. And I'm blessed to be adopted. So he is not my biological father, although he's been my daddy all my life. I don't know genetically that I will pick those things up because I don't share that same gene pool. There are stages of dementia, and I picked this screen because it shows 4 general stages. If you talk with someone or a doctor you're dealing with an Alzheimer's patient, there are actually 7 stages of Alzheimer's. But if you look at this chart, you can see different stages have different criteria, but it could be different with every type of dementia. So the substituting words, not being able to make complete sentences could be Alzheimer's. The ability to dress unassisted, that could be a Parkinson's, physically unable, to do that, or it could be frontal temporal, where they can't follow instructions and understand what they need to do next. Wandering, and we're going to talk about this in the next session that we have, where we're going to talk, I think that one is on behaviors, dealing with dementia behaviors. Wandering can happen at any stage. And I always have people say, well, we're not dealing with that yet. So I will say early on in this, don't wait until we're dealing with that happens, because you're not going to be prepared. We had one gentleman in a caregiver cafe that I host said, well, we're not dealing with that yet. And the next week he said, while I was at that meeting with you, she got out of the house, wandered down to the intersection of a busy road and fell in the roadway. So you have to think ahead, at some point that connection in their brain that tells them, it may tell them it's time to go to work, or we need to walk to the store. You don't know these things. So it can happen at different points. If you have a certain type of dementia, you can research stages of that type and try to see how you can be more on track. And I'll also say dementia, any type, is like stair steps. So, our learning curve is like a rocket. We have no time really to get a lot of training and understanding, which is why I'm happy to bring the workshop to people. But so our learning curve is like a straight up, rocket ship. However, when you're dealing with somebody, you'll see them go into some stage where you can tell they're at a different stage. So something's different. Like for my mom, In the last month, she seems to, when I take her to a store, she wanders and just looks with a blank stare at all kinds of things. It could be because she's been locked up from COVID. I think a lot of us are like that, but it's a very distinct difference. So I know she's taken a stair step down. The ability to cook for herself may be something that goes next, where she puts a metal spoon in the microwave, something like that, that's unsafe. So you have to start looking at things from a stair step, which is unfair because we get used to where someone is in this phase, and then they drop and we're not sure how to handle that. So when we talk about dementia behaviors, we'll talk some about different things that you can try and do, and hopefully that will be helpful. So what do you do if you think you're dealing with dementia? So if you notice signs of dementia in yourself or a loved one, my first recommendation would be to see a physician and explain your concerns. What's different? What kinds of things do you see? You might take notes because it's sometimes hard to remember things that happen. I would recommend that you talk with close family members and friends who may spend a lot of time around you or your loved one that you're worried about. See if they note differences. If somebody just comes to visit, they're going to say, oh, they seem fine, because we kind of laugh about it sometimes. It's amazing how they can turn a switch and act like everything's okay in front of somebody, but you know what's really going on behind the scenes. So having somebody come and stay a weekend sometimes will open their eyes and they'll see what you're talking about. Ask the person that you're, taking care of how they think their memory is working. My mom has a part of her disease is that she can't accept or acknowledge that she has Alzheimer's, even though her doctor discusses it with her. She thinks she's functioning perfectly fine, that she walks at a normal pace. So she doesn't have a realistic view of it. I mentioned to her daughter, I said, I think she's in denial. And he said, she's not in denial, because to be in denial means that you have to see something and deny that it's there. He said, for her, everything that you're talking about is something that she thinks is real. She doesn't see it any other way. I would heavily say don't self-diagnose. There are a lot of conditions that can cause dementia. There are medications that can cause signs of, symptoms that are related to dementia. Urinary tract infections in a senior can have a lot of symptoms that look like dementia. So don't self-diagnose that, but do get some help. If you see a progressive pattern, that should alert you. If you see a dramatic change, that could be medication or something else going on physically. Offer assistance to the person that you're, if it's you, look for assistance. If it's someone you care for, offer assistance. Try to help them stay independent and find things that simplify their life so that they can function independently. And look after yourself. The incidence of caregivers becoming ill or having issues prior to the death of their loved one is extremely high. My mom, when my dad was diagnosed, she's a very strong woman, but it was overwhelming. All of a sudden, she was caring for him, doing everything she did before and trying to do everything that he did around the house, dealing with finances, all those things. So look after yourself. So that's what I wanted to cover initially, and I am open to questions. So I will let Tracy jump in, and I'm going to stop sharing there and let Tracy take over.
Thanks, Lori. Great information. I only have one question in the chat box at this moment. So we have a question from Betty. She says, we're experiencing REM sleep disorder. Her spouse acts out, such as dreams, choking, hitting, calling out, cursing, like in the middle of dreams. So are those signs and symptoms that she should maybe talk to someone about?
They could be. In fact, Lewy body dementia, that's one of the things that we know about that type, is that sleep disturbances are one of the symptoms that we see early on. So that could be, you know, I'm trying to think, I mean, their frontal temporal causes that hitting, people cussing that never have cussed in their life, those types of behaviors. But if it's happening in his sleep, then it could be sleep related, but it could be a Lewy body type of dementia. So just one thought on that. I would consult your physician and ask, but if there are any other symptoms, Betty, I would definitely start looking at that. And hopefully I've given you a little bit of information to think on for that.
I don't have any more questions in the chat box at the moment, Lori, but we do have a guest. I consider her a special guest. Rebecca Kelly is our AARP Tennessee State Director, and she is on the call. So Rebecca, would you like to join us? I know we can't see you, but we can definitely hear you if you'd like to join us, if you have questions or input.
Hi, Rebecca.
Hi, Lori. Thank you so much. It's just such good information. And we at AARP in Tennessee are just delighted to have you as our guest and expert on this issue. I think you know that I personally am dealing with dementia with a parent, and it is challenging. And it's just nice to know that AARP supports caregivers, and we know that many caregivers are caring for people with some form of dementia. So thank you so much. This information is great. We will a little later give you additional resources if you're listening in, and encourage you to join more of these sessions that Lori will host in the next few months. Just thank you so much.
Well, I am happy to be here, Rebecca, and I feel for you because we live a parallel life. I think when we talk with caregivers, it's a special club because if you haven't been through it, sometimes you just really, if you've been through it, you understand. If you've not been through it, people can make comments, but they don't truly understand, the depths of the emotions and things that you deal with. I think a lot of, for a lot of caregivers, there's that wish that their loved one wouldn't suffer with this anymore, but that is also the wish that they're going to be gone. Mm-hmm. So it's hard to balance that sometimes without conflict. And it's also hard to balance being the caregiver and being the spouse or the daughter or son. They're conflicting roles. So I understand where you're coming from.
We have a couple of comments in the chat box. I have posted, you can find all the other information on our Caregiver Cafe sessions. We're going to do those once per month. It's always on the first Tuesday of the month at 2 p.m. Eastern time. And so I've added the link in the chat box so everyone can go to the link and find those other dates. And then we had a comment from Sarah that said, great job, Lori. And then we had another comment that says, my mother-in-law doesn't want to eat anything except breakfast. We have to argue with her for lunch and dinner as she doesn't want to eat anything else. She's 89 and says she doesn't like the food, and it will be something that she used to love to eat.
Okay, this is a common one. There are a number of things that go on in dementia. One is the part of your brain that controls your taste buds and what you like. As that deteriorates, people don't really want to eat. Nothing tastes that good. I will tell you that sweets, typically that sweet tooth is the last thing to go. So that's one thing that that I would say. I've had people say they sprinkle sugar on chicken and steak and anything that you want them to eat, try putting something sweet on it, and that helps. Also, and this is just really hard to talk about, but the end stages of the disease, people will stop eating and they'll start sleeping longer and longer and longer periods. And it's very distressing to the family. We want them to eat and we want them to drink and we want them to do all these things that sustain their life, but it's a natural progression into those end stages of dementia, where the taste buds are gone, the their hunger is gone. They don't want to drink sometimes, which can really cause a lot of issues. So we really encourage people to drink. But so she eats breakfast, and arguing about lunch and dinner. I don't know, Karen, if this is the same situation, but I can tell you that my dad, he wanted meals on clockwork. Is noon, it's time to eat lunch. So, and you'll see that in a lot of dementia patients, they're very tied to that clock. They know that at this time they do whatever, but he would sit down and wouldn't eat. I can't eat this, I can't eat this, and over and over and over. And there was always him saying he couldn't eat it, and us saying, no, just take one bite, just take another bite, just take another bite. And somebody said, don't do that anymore. Sit down, put the plate in front of them. It doesn't have to be piled with food. Just put a little bit of things that hopefully they'll like, and talk about the weather. If they say, I can't eat this, don't even acknowledge it. My mother and I were like, right, this is going to work. And actually we did it. We talked about the weather and vacations, and he actually ate everything on his plate. Oh, wow. So there was something about us pushing that, which was causing some type of tension. So he would eat in it, and we found if we put it on the table, he would get second. So another thing I will tell you is, and I don't know what stage, Karen, your mother-in-law is at, but if you think about it, if you have a plate with chicken and applesauce and corn, and you set that plate in front of somebody, first of all, we talked about visual impairment. So everything on that plate is kind of a beige, gold, yellow, all kind of the same colors, okay? And then they have to stop and think, well, so with this chicken, I've got to cut it up. And with this applesauce, and what do I use to eat it with? This is a fork. So the fork goes in the chicken. Applesauce, you can't eat applesauce with a fork. You have to use a spoon. So there's another decision or thought that they have to come up with. And the corn, well, how do you eat the corn? So think about colors. Think about giving them one small bowl of one thing, and see if they will eat that first. And if it's applesauce, give them applesauce with a spoon. Then come back and give them something later. So food issues happen a lot. But it's also a natural course of the disease. So sad but true. Anybody else?
No other further comments or questions. Lori, I'll share a personal story. My husband's mother, so my mother-in-law, I didn't have the pleasure of getting to meet her, know her. She passed before, but she was deep into Alzheimer's. And so the story told was they picked her up from her living facility, his brother and his wife, and put her in the back, and she started to weep and cry and called him her husband, Frank, and said, why am I in the back seat, and why are you holding hands with that woman? Yeah. And it was such a sad story, and that has stuck with me just from the first time I heard it, of how sad this disease is, for family members.
Yeah, it is. It is. And, that day, everybody dreads the day they walk in and their loved one doesn't know who they are. See, and you'll get me crying because I live this with everybody else, every day. But you have to look, caregiving is an honor. I have two brothers. They don't live close by. I can't expect them to quit their jobs, leave their kids, and come help me. Sometimes it's an overwhelming burden. It is a burden to some extent. You don't want to tell your loved one that, but it does take over your life to some extent. So taking care of yourself is a good thing. Finding support groups, that people you can talk to, that can share stories and you can laugh. I had a lady who told me the story about her mom was living with her, had Alzheimer's. She and her husband were out in the backyard, kind of cleaning up the landscaping, planting some new things. And if the mom came out and she had 2 shopping bags. She opened the back door and she said, honey, you have got to come in here. They're having the best sale. She had put lamps from the house. She'd gone through the house shopping, put them all in the bag, and was so excited that she had found all these things. And she told us that, and we just laughed and laughed about it. I mean, her mom was having a good time. She had a few things she had to put back into place, but you know, it was a great story. And there are those things that you can sit back and laugh and just know your loved one, even where they are, can have joy, and you can help in that. Let's see.
I think Rebecca asked a question. Can you say a little more, discuss a little bit more about how to answer their questions, especially if you think they should know the answer?
Okay. And it depends on the question, Rebecca, if you want to chime in, but, you know, there are people who will ask, you know, if you're leaving them, what time are you going to get back? What time are you going to get back? And they may call it, sometimes using a dry erase board and writing information that they ask over and over will help. I just talked with a friend of mine from college who takes walks with his mother-in-law, and she says, how am I doing? Am I doing okay? Am I doing okay? And he said, by the time we've walked 200 yards, I'm losing my mind, because she says that continuously. Music is another thing in the brain, a memory in the brain that lasts a long time. And so I said, why don't you try this? I've not heard anybody recommend it, but it would make sense that if you started singing a song, she would start singing along. I said, sing Amazing Grace, sing something she knows. And he said, it worked. He said, now we walk and we sing, and she doesn't constantly ask the questions. If they should know the answer, they may not know the answer anymore. My mother was asked the other day, we were making a phone call together about a credit card that she had given to somebody, that poor judgment, and they wanted her last 4 digits of her social security number. She rattles off a number that was totally unrelated. Little things like that, you just kind of have to do that for them. And Rebecca, if there's a specific type of question, let me know.
Yeah, she commented back, Lori, that said more like if they weren't sure who the family member was. Like I said with my personal story, if they don't know who the family member is, how do you respond to that? And she said, such as a grandchild, if someone, you know, doesn't even know that that's their grandchild.
Sometimes you can't fix that, but the one thing when family members are visiting, a lot of times you might want to prepare them with pictures and say, this is Bobby. He's going to come visit you today. I would tell them the day on, show them the picture. This is Bobby, and try to orient them to who's coming to see her. And then also tell them not to come in and say, do you know who I am? Because it puts them on the spot. It's a very uncomfortable place for them to be. But to prepare them in advance, or to introduce this person as if they may not know them. This is Tracy. Remember, Tracy is married to, you know, whoever you're married to. Tracy, I can't remember your husband's name. But I mean, you help them put that person in place. But I wouldn't go in and say, you know, do you know who I am? Or do you know who this is? You know, take that pressure off them and help them along with that. If you can prepare them for who's coming, that makes it even better. And sometimes that won't work, and they're at a point where you can't do that, but they want to know that person. They want to be where they know all these things. They just can't sometimes.
We had someone that joined us late. They're wanting to know if we can obtain a copy of the recording. Yes. So we will, this is being recorded. And so we will either post this on our AARP.org Tennessee page, or I will see if we can actually e-blast this out to the folks who registered. So if you actually registered for this webinar, I will talk with my communications director and see that we can get this back out to everyone who registered. Let's see, we have one from Rita. 3 years ago, after a neurologist performed some tests, her dad had dementia. We were not sorry, it scrolled on me. We were not told the type or the level. He was prescribed an Alzheimer's medication and depression medication. Since that time, her dad refuses to bathe. He used to never skip baths, has trouble paying bills, keeping track of medication, easily confused. Just looking for next steps, Lori.
One of the things that I really encourage people to do is if you're going to a physician you've been to all your life and they've seen you in your normal state, sometimes they don't, they'll discount symptoms that are happening. But here you've got somebody who's had tests that say there is dementia. I would look for a physician who works in geriatrics, who is accustomed to working with somebody with dementia, and see if there are any medications that could help with symptoms. The bathing, skipping baths, I mean, that is standard symptoms, things that happen. As far as paying bills, medication, and all those things, I would start looking for ways to assist in that, whether it's a family member or a professional. That's, in-home care can come in and help with a lot of things, but they can't distribute medications unless it's a medical professional, but in-home care doesn't typically do that. I took over putting medication in boxes for my parents. At this point, I've taken over paying the bills, but it's another role of a caregiver. But I would start thinking, how can you keep him safe financially, safe physically, and start taking steps to do that. We're going to talk some more about that in future sessions, but simplifying life as much as you can will help quite a bit. The bathing, one thing I'll add on that, if somebody took a bath in the morning their whole life and you're trying to give them a bath at 5 o'clock, that doesn't seem right to them. So try to think, when did they take baths before and where did they take baths? Try to make it a familiar time and setting for them. That might help a little bit. All right.
Awesome, Lori. No more comments or questions at the moment. So if anyone has any comments or questions, if you'd like to get those in shortly, we're almost up with our time. I will post again in the chat box of the link that you can find our next Caregiver Cafe sessions. Again, those will be on the first Tuesday of the month for the next.
I've got a slide with that I'll put up.
Oh, do you? Great, Lori.
Yeah.
That would be great.
Let's see. There we go.
Great. Yeah, there's the dates and the time for the next 3. And again, I'll put that in the chat box with the link. Lori, we did have one more question asking, can you talk about sleep patterns?
Okay, another challenge. And it really, there are different challenges that people have. Some are somebody stays up all night and they sleep during the day. I'm going to go back and stop sharing so I can see this question a little bit. And I'm going back to some different caregivers that I've dealt with sleep issues. A lot of times people will sleep more and they sleep during the day, but they stay up at night. So if you can regulate that and keep them out walking or doing some type of physical activity and keep their wakefulness during the day up, they may sleep better at night. A lot of times medication is another way to help that because there's anxiety and things that keep them awake. So a physician can prescribe something that will calm them at night. The other thing is where they're sleeping. It's kind of like we talked about before. If they're in a new place, that may cause an issue, just like the showers. If you've moved them into your home or a facility and they may be disoriented and just body chemistry is off. So let's see. I see this one. What if you know a parent has dementia and they will not accept it and will not allow anyone to be of help with the bills? What can be done? First of all, everybody should have a power of attorney. That allows you to step in when a parent or a spouse is no longer able to take care of themselves, especially if they have a diagnosis of dementia. And that's what happened, in our situation. And I have a brother who's an attorney, so he's a smooth talker, and he was able to tell our mom, all our life you've said, you didn't want to be a burden and all these different things, and that you trusted us to make good decisions. Well, we think the best decision is for this to happen. And someone has to take control, and it needs to be done lovingly. But, my mom is well into her journey with Alzheimer's and still does not, it's not that she can't accept it, she can't see it. But she knows there are mistakes being made and things that are happening. And my husband, while she and I might clash because we're mother-daughter, she respects my husband so much that if he says something, she believes it. So sometimes the person who, for a daughter to be saying it may be very hurtful. It's hard to talk to somebody who put your diapers on and tell them that you're going to take over. But another loved one who they respect might be in a little bit better situation to address that. I don't know that helps a lot. It's still a challenge, I can tell you from experience. So.
Absolutely, I'm sure. So we had another question from Amy. It says, how does she find a support group for caregivers? She's tried looking online, but hasn't had any luck. Is there a resource that you can offer, Lori, for support groups?
Alzheimer's Tennessee, if you're in Tennessee, Alzheimer's Tennessee has statewide online support groups. There are some in local areas. I host 2 a month, but I'm in Maryville, Tennessee, so that may not be where you are. And I'm hoping to open up others, but there are a lot of online. I don't know if AARP has any online other than something like this, but the Alzheimer's Association and Alzheimer's Tennessee both have some online caregiver support groups. There are a lot that have not opened in person because of COVID.
And
but
I
do
did.
think it's important to find that.
Yeah, I did, Lori, post in the chat box that the AARP national website, so it's aarp.org/caregiving. And so that's our national resource page for caregivers. So there's all kinds of resources and information. We have the AARP National Caregiving Guide that you can get free on that page. So I posted that in the chat box. We also had a question that says, does a person with dementia, their hearing get better? It seems like it has for this person.
That would not be one of the symptoms that I've seen a lot, but it does. There are some types of dementia that might enhance a certain part of somebody's brain slightly. So, I mean, that's a hard one, but typically hearing does not get better. But it could be just something that they're more in tune to at this point. For some people, they want music going all the time. I mean, there are different things. It's an odd disease. So, but I haven't heard about hearing getting better.
That's a new one. So we had from a caregiver that says, my aunt will not talk to me unless I'm bringing her food. She curses, tells me to get out of her room, leave her alone. She doesn't want me to help her to do things like dress, go to the restroom. There are others who do come to care for her, and she loves it and normally will laugh and talk to them. Not a smooth talker, nor am soft-spoken. Any suggestions?
Oh, goodness. Well, one thing I will tell you is that you want to be loving and kind to these folks because they can't control things. However, you also have to take care of yourself. We go back to safety. That's probably because my mother can sometimes turn on me, and it's very hurtful. She forgets she did it later, but it stays with me for a long time. So when somebody treats you like that, it is fair for you to say, I'm trying to help you. What you're saying is not fair to me, so I'm going to leave, and excuse yourself from the room. The other option is that if she doesn't want you taking care of her, who does she want taking care of her? Can you hire a, in-home care person that would do that? So not as a threat, but be firm. My mother's yelled at me on the phone, and I've said, this is not a fair discussion, and I love you, but I'm not gonna let you talk to me like this, and we'll talk later. And she doesn't remember it later, but I feel like I got off the phone and handled it well. Let's see. I see you've added to that. She's wandered off before and tries to leave when others come. Doesn't remember the names of family members. Yeah, the wandering, I would be very, very careful with that, because that's a dangerous thing. And if she's done it before, it could get worse. So you're in a precarious situation. That's, but yeah, if you're not a smooth talker and you're not soft-spoken, just say it like it is with as much kindness as you can, but you don't have to, when somebody's being abusive to you, that's not a safe environment. And so you handle it the best you can. We're not always sweet, nice caregivers. I will say real quickly, I was in a store, a Dollar General, the other day, and a lady was escorting her mom around going, "Mama, do you need some paper towels? Mama," just as sweet as can be. And I thought, I feel terrible because I don't always talk so sweet to my mother. I'm not ugly to her, but sometimes there is a edge of agitation in my voice. And I mentioned that to somebody, and they said, "You don't know what she talks to her mother like when she gets in the car." And I said, "That's probably true, you know."
Right.
It's hard sometimes.
Well, Lori, this has been such valuable information and a great session. We're at an hour, so I want to thank you so much for spending an hour with us and starting this wonderful series, Caregiver's Guide, Dealing with Dementia, our virtual Caregiver Cafe sessions. This is the first of 4. So our next one is June the 1st. So we'll be dealing with dementia behaviors for the next one. So again, we've put that link in the chat box, as well as the AARP national website. So aarp.org/caregiving. And again, we'll put the recording on our website and try to get that e-blasted out to everyone who registered for today's session. And we look forward to everyone joining us on June 1st. So Lori, thank you again.
Thank you.
Any closing remarks?
I applaud everyone out there who is on this call, because it's a tough disease and you care enough to come and learn. And so to me, that is a sign of a good caregiver and somebody who really wants to make a difference in somebody's life. So I applaud you all for being here.
Thank you again, Lori, so much. And we'll see you June 1st.
Okay, bye-bye.
Thanks.